everybody, and welcome. It's fabulous to see so many people here. It's really impressive, so thank you very much. And thank you also for being cognizant of the social distancing. We've tried really hard to set it up so that we are abiding by what is needed and required. So if I can just remind you to keep that in the back of your mind, that would be great. Before we start, just quickly some housekeeping. The toilets are through the door there, or there are outside toilets just as you came in the building. If we do have to evacuate, I can't see that that is likely, but if we do, if we could all just move same door as you came through, and we'll assemble out at the front. And follow me, and Judy might bring up the rear, I think, so that will be great. And I'm going to invite Trevor to come forward, please, from number 34 to do an acknowledgement of country.
Thanks, Emily. So I'd like to begin by acknowledging the traditional custodians of the land on which we meet today and pay my respect to their elders, past and present. I would also like to acknowledge my gratitude that we share this land today, my sorrow for some of the costs of that sharing, and my hope and belief that we can move to a place of equity, justice and partnership together. I would also like to acknowledge Aboriginal people who are with us today. Thank you.
I'm Julie Jacobson, a very proud Central Coast girl, born and bred here, went through the school system here and have chosen to live here. So I really don't know why anybody would choose to live anywhere else. And I think what you'll see today is another reason for living here, because we belong to such an amazing community of people. And what you'll see in here today is a celebration of how people have come together to look out for each other and make living in the Central Coast even better than what it is. So we're in for quite a treat, hearing from quite a few guest speakers. I'd like to just acknowledge our speakers for today. So we have Dr. Emil Djakic, Flora Dean, Judy Walker, Susan Banks, Gary Walker and Hayley Baker, Covey, and Mayor Jan Bond. You'll hear from all of them shortly. I'd also just like to make a special welcome to our collaborative partners in Collective Ed. So it's really great to see our Emil and Sean here, and it's been great working with you. And again, through the afternoon, I think you'll hear how fantastic it's been for the two groups to work together. A few apologies for our meeting today. Jeremy Rockcliffe, our Deputy Premier, has sent in a lovely email as an apology. Councillor Amanda Diprose, Simon Douglas from Alston Neighbourhood House, Annie King from New Mornings, Annette Loudon, Chris Fletcher, Christine Winskill, Dr. Lizzie Shires, Elvie Jean, Megan Bond, Diane Hattaway, Sharon Gillian, Vanessa Morley, Richard Colbeck, and the representative from Care Beyond Cure. So they are all apologies. On your tables, you'll notice there are some sticky notes and pens. While you're listening to the speakers today, if you think of a question or a comment or a thought, please just jot it down on those sticky notes. Hopefully we will have time to ask the people that are relevant to that question for the answer, but in case that doesn't happen, we'll collect the sticky notes and we'll get back to you with the answers. So if you would like an answer, please put your contact details on there and your name. But if it's just a general question, then that's not necessary. I'll leave that up to you. Also on your tables are some postcards and fridge magnets. We would love you to take these with you when you leave this afternoon and spread the word. So share those with as many people as you can. Okay, let's get started. So our first speaker today is Dr. Djakic. Emil, can I ask you to come forward, please?
Rick Link got involved when this project was brought to the coast to at least accommodate and to develop it and see what we could put into place. I think we can all recognise, those that have been involved with it, that how we started out probably isn't how we finished, but that's okay, because it was about a learning process and a development process. I think rather than revising all of the history that's gone on, I would congratulate everybody that's worked the project, particularly Judy Walker, who's been our project lead through this. I think, as we may all know, without Judy, the journey through this wouldn't have progressed, and we wouldn't be here today celebrating the outcomes of it. I'd like to draw an analogy, though, to the outcomes we've got to something that's been close to us all over this last few months, which has been the COVID-19 virus. Why would I be talking about that? Most of the congratulations and most of the celebrations seem to be focused at healthcare workers, particularly at the pointy end of the spectrum up in the hospital sector, which no detraction from them. Fabulous work, fabulous roles that they're all doing, and terrific that they're there. But the missing congratulations actually extend to the broad community, to the individuals who are sitting at tables, social distancing, who are choosing to use hand sanitizer, who are choosing to talk to each other about how you're going, how you're getting on, are you coping, who are knocking on their neighbour's door, who are connecting to each other in a way that is about bringing the greater good to all of us. Now, the Anticipatory Care Project is working down at that true space of primary health care, which is in connecting people, in talking about health issues, in identifying who's in our community and how we might direct them, how we might guide them, and how we might borrow from their existing skills and knowledge, is really where the beauty of all this is. I think if we go back 10 years ago, and I think Jan Long might help me remember the year when we sat over at the rowing club in the hall there doing strategic planning for the council. My first impression after a bit of the work there was that there was an absence in a health space for this community, in a map or a guide or a program that belonged to the council, the third layer of government in this country, as to what we were doing for health in this community. I think we now are on the cusp of an opportunity to really fill that space with something that's quite progressive, innovative, and owned by us, and a fabulous opportunity to recognise through the council and the councillors and Jan Bond as mayor in choosing to absorb this program into part of their workspace for the future, which is the really exciting bit. That funding as such for this will end in its original form, but what we've got is a structure, some governance to go with it, a plan to go with it, and more importantly, people who are from this community, who are engaged with it, who have been with the journey with it, and who are committing to continuing with that. So I think we might think this has been nebulous, we might think, show me some tangible benefits, but I'm a big fan of not so much frontline troops, but what actually happens in the back room to enable those frontline things to occur, and I think that's what we've got for the future. So from my side and Patrick Street Clinic, we've been really proud to allow this to move onto this form, and yes, we're stepping back from it not because we're abandoning it, but because its opportunity and its true home now sits in this next future. And I think we will have other municipalities looking to Central Coast and saying, how did you do that? And it'd be really nice to be still sitting here reviewing in 1 year or 5 years to see what the progress is and how we are connecting with our community and how we're all contributing to the little bit we each can do to provide the opportunity for good health for all of our community members. So thank you all, and as I said, thank you, Judy. Now I'll hand back to you. Correct.
The thing that Emil's pointed out is that it started off as a project that was managed by a small few, and what's really wonderful is that ownership has grown, and it truly is now a community project. So the fact that we're hoping to move now into a self-sustaining project, and it's up to everyone in this room and those beyond this room to spread the word so that what's done so far in the project continues. So thank you, Emil, for that. Our next speaker is Flora Dean, and Flora has been the Principal Project Officer for the Anticipatory Care projects around the state.
Thank you. Oh, it's nice to see everyone. As Julie said, I'm with the Department of Health and have been involved in this project from the outset. The Anticipatory Care project actually involves Should be okay. Right. The Tasmanian Anticipatory Care Project is actually a project funded by the Australian Government and has involved 4 Tasmanian communities. So Jacobson is one of 4 Tasmanian communities involved in the project. And those communities include Flinders Island, Ulverston, Clarence and Launceston. And I must thank Emil and Patrick Street and Ulverston, the Ulverston community for getting behind this project. It was a strange beast that we came to Patrick Street with. We had a very broad scope about what we were trying to achieve with this project. And it was really a project about trying to understand what was happening in terms of, or what could happen at the local level to improve health and wellbeing. So trying to explain that term anticipatory care, which is a term that came out of the UK. Anticipatory care really is about anticipating health problems or anticipating how we might improve health, foreseeing potential problems and then looking at interventions or ways to better support health in the local community. So that's really kind of where the term came from. So this was very much a learning project as well as a doing project. So it wasn't about us coming to a local community and saying, here's a project and here's a solution and we want you to go away and implement it. What we really wanted to do was learn from local communities about what works best for your health and wellbeing. So it was very much a learning project. The 4 communities, I'm not going to speak too much about what Ulverston's achieved, but you'll see that they have achieved amazing things over the course of this project. And I think it's been one of those rare opportunities where we've been able to come with some resources to a community and say, you design it, you drive it, you do what you think is right for your community. And our aim is really to learn from that and get a better understanding of what actually works in local communities. So the other communities have delivered a whole range of activities and projects. In Clarence, they had a strong focus on health literacy and improving access to health services. On Flinders Island, there was a strong focus around cultural safety. So some of the early work that Susan Banks and Nick the UTAS team did at the beginning was really talking to the local community and finding out what were the key issues that were important to that local community that better support health at the local level. And for Flinders, cultural safety was a key theme that came up. So they've done lots of work around working with the local service providers around improving cultural safety. Alcohol awareness was also another issue that was raised at that local level, and they've designed a range of programs to actually raise awareness, and having that locally driven has been really important for Flinders because it's those local messages, local families talking to other people that really has been able to raise some awareness there. In the northern suburbs of Launceston, there's been a focus on sort of trauma-informed work. And again, that came out of early consultations. So one of the initiatives that they had was an adventure play program targeted to local young people. And they've also developed some really strong connections with local health service providers, in particular a GP practice that they're working very closely with and looking at ways to better connect people with GP services. And that GP practice coming together and working much more closely with the local community about tailoring their local services in that space as well. But at the end of the day, it's all been about connecting up local systems. That's really been the kind of thing that's so rather than us all working in isolation, it's about how people are coming together, identifying local issues and looking for local solutions. So I hand over now to Flora.
Quickly now, just how amazing Judy is to work with. So it was quite difficult coming in without any idea of what was going to be, what was going to be involved with this project, but Judy has an amazing knack of drawing all these things together and making sense of them. So you'll hear that as Judy speaks, I suppose, and we'll acknowledge her and the rest of the team later, but it's just important, I think, now for me to just Judy, how fabulous it's been working with you. So let's hear from Judy, and don't forget, if